Welcome to Fertile Minds. My name is Dr. Veronica Knight and I'm a fertility specialist working with IVFAustralia. Today we're going to be discussing the topic of secondary infertility and what that might mean for couples who are trying to conceive a second child and who might be experiencing some challenges. Secondary infertility is when a couple might be experiencing difficulty falling pregnant or carrying a pregnancy when in the past they haven't had any troubles at all. Secondary infertility is actually more common than people might think. About 1 in 6 couples will experience infertility in their lifetime, but around 1 in 10 couples will find that they have difficulty falling pregnant with subsequent pregnancies when in the past they had no troubles at all. Secondary infertility can occur for a number of reasons. One of the most common things is that a woman might be older in her second, third or fourth pregnancy, and she might face some of the age-related complexities with conceiving. There are other reasons as well. So in between pregnancies, a woman or a man may have started to acquire new health concerns that affect either female or male factors. So for instance, a woman might have developed some fibroids or a uterine polyp that will impact on a pregnancy carrying, or she could have developed some issues with endometriosis or infection causing scarring to the tubes. So there is a variety of things that could be causing the problem, and that's where a fertility specialist will guide a family through a set of investigations to work out what's going on. There's lots of options for families who are facing secondary infertility, and some of those things may be non-surgical options, but there are also procedural things that may need to happen. A fertility specialist will guide a couple through the investigations and also some of the treatment options that may face them. For instance, if a woman has had endometriosis, that might need to be treated with a surgical procedure prior to going on to try and conceive either naturally or through assisted conception with IVF. Other times it might simply be getting on top of some of the lifestyle factors that can affect us as we get older, and addressing those things can help a couple fall pregnant naturally. So we can't underestimate the emotional impact that this will have for couples who are facing secondary infertility. If a family has sailed through a pregnancy or birth before, to face new challenges can be really a time of guilt or worry or concern about something bigger going on. And in those instances, it's important to keep in mind that there are solutions available and to seek the advice of your fertility specialist early so you can start tackling some of the problems. My advice to couples who are facing secondary infertility would be not to delay seeking help. You might feel like just a few more months of trying might get you across the line, but in fact it can just end up building more anxiety and worry. And if we're facing some of the age-related concerns of secondary infertility, the sooner you get onto the investigations, actually, the sooner we can help get someone on their pregnancy journey. Thank you for watching. For all things fertility, please feel free to subscribe.